Hi everyone, my name is Karen Dees. I am the Marketing Manager for Patient Concierge Services. For those of you that don't know who we are, we look after men and women, usually coming from Australia for cosmetic surgery. We do the full concierge wraparound service as well as now booking appointments. And we have the privilege today of meeting Dr. Rosa, who has Eterna Clinic, and we're learning lots and lots about the wonderful things that are on offer here. So not cosmetic surgery, but lots of different alternative treatments that you could do that might prevent you needing surgery. So Dr. Rosa, could you tell us a little bit about yourself?
Yes, I have a long name. My name is Rosalina Sylvia Dewi, but you can just call me Rosa.
Rosa,
yeah,
beautiful.
My patient just call me Dr. Rosa. It's very simple.
Yes.
And a little bit about my background. I have been in the field of aesthetic and anti-aging medicine for probably over 18 years now. It's been a while. Yeah.
You don't look old enough.
Oh.
You clearly are investing
Thank you.
in yourself.
Yeah.
Wow. Yeah. So what is your area of expertise? Is it anti-aging, wellness, a bit of both?
As you know, you see the Eterna clinic here. We are focusing on the anti-aging, also the aesthetic.
Yes.
And then basically what we want to target here is that if a patient feel not confident about themselves, feel not confident because of, like most likely because they want something to do with their appearance, face, neck, or body. But other than that, we also focusing on other things for you can also feel not confident from other things like women health, for example. That's why here we also provide women's health treatment, which is more in the gynecological area.
Okay.
Yeah, for vaginal fat tightening, as simple as that.
Yes.
Or women when they are certain age and multiple childbirth, they can have, I think it's urinary leakage.
Of course.
We also have a treatment for that, and it's important in boosting self-confidence. Yeah. So when you talk about what is our focus here, we are focusing on personalized treatment for each patient. So we design whatever the patient needs, and then of course, we listen to the patient and design what is suitable for them. It's quite personalized. Yeah. We try to provide everything. We, of course, nothing is perfect. We still also growing, we still developing. But at the moment, that is the treatment that we have, other than all the aesthetic aspects.
I absolutely love that. So it is about confidence, empowerment.
Correct.
And I guess prevention as well. So it's so even if you felt pretty confident about yourself, but you wanted to take action and certain measures to maybe slow the aging process.
Correct.
You can do this too.
Yes.
Yeah.
Usually when the patient come, of course, if they come to the place called aesthetic anti-aging clinic, they want enhancement.
Yeah.
Right. Yeah. So what we try to do here is that we try to provide all the equipment with the latest technology that can help them achieve that.
I had a little look at your website, and there's a huge menu, right? Huge menu from face, body, women's health, and for men's health as well. I noticed there's supporting men with snoring issues and that kind of stuff. So we could probably spend hours talking about all the different choices and all of the different machines. But from my understanding is you have the best technology. So when people want to invest in, they're getting the real premium service. But what would you say are the most top 3 popular treatments that people come in for?
Okay, if we talk about top 3 most popular treatment that people came from, is actually quite difficult, challenging to answer, because every treatment has its own strengths. And then, as I said, that this clinic is really focusing on the personalized treatment, so it depends on what the patients need, and it can be very various. They can have multiple things that they want to do, actually. But let's talk about the technologies that we have here.
Technology, that's a good one.
So let's say one of our machine, Ultraformer MPT.
Ultraformer MPT.
Yeah, it is also one of the most requested machines, because it's an option for a non-surgical facelifting.
Okay.
Especially for those who already hit the mature age, you know, like they almost get menopause or they pass menopause. Even for men, who really concerned about how they look and they want to look younger.
So is this when a man or a woman just starts to notice the elasticity dropping in the skin, maybe the collagen is a bit less?
Yes.
So this would be like a stimulator?
Stimulator, but with a machine.
With a machine.
Yeah, with using the latest HIFU technology.
Okay.
We call it MMFU and PT.
I used to get HIFU facials when I was in England, but apparently they've advanced more now. You can get, there's more stronger machines that can do better jobs. Is that right?
Let's say it's not like really stronger, because strong doesn't mean good also. So it's something that you can do in many repetition, and you can adjust the mode inside it. So what people love about it is that it's a quick treatment.
Okay.
And then you can see the natural result quite instant.
It's quite instant?
Yeah, you can see it quite instant. And then over time, it will even like getting better after this treatment. So, and then the next that we also have a very versatile machine. It's called Fotona.
What's it called, sorry?
Fotona. So because we can use it from head to toe treatment.
What is it?
So it's like a combination of treatment. A combination of laser beam.
Laser.
Yeah, laser beam. So we can treat like the face. We mostly use it for the aesthetic purposes, you know, like to rejuvenate tighten the face. Yeah, and then we can use also for other things like scars, like stretch marks.
Wow.
And even like we can have a mode for like a tight sculpting to help tighten the skin.
So the machine has many different settings depending on the person. What about spider veins?
Including spider veins.
Because we get asked quite a lot about this.
Yeah. So also we have also quanta lasers here, which will rejuvenate the uneven skin tone. And it's a very good option. And then when you have not much time to have yourself a treatment, because if you're busy, you only have like a short time treatment, then we have also a lot of other machines that we can also tailor for them, you know. But even like there's an ablative machine like CO2 or erbium that we have here.
Okay.
But there's also another machine that can also do what they can do in a different way.
Yeah.
So it doesn't need to be fully ablative.
Okay.
It's not ablative.
What does ablative mean?
Ablative means that you are going to resurface the skin. Oftentimes, they want a result, but they don't want a long downtime.
I was going to say, I've had CO2 laser and the results were beautiful, but I looked like Freddy Krueger for 2 weeks.
Correct, So we have an options for that. But you know, individual,
you don't have to have the downtime?
Yes, you don't have to have maybe the downtime from CO2, let's say 1 week.
Okay.
Yeah, and then even the next week, you still need to be very careful with the sun
because it's like really raw.
Yeah, because it's very new skin, and then it's very prone to get another damage again, which probably can be worse than you were before if you damage your new skin. The next after you do the CO2. So then in that case, we also have the other things.
That's really good to hear. You understanding like the risks, which is why it's so important for anybody watching to make sure that they come to a fully qualified doctor who understands these machines.
Yes.
Because they need to look at their skin, and like you say, it's a case-by-case situation. They might have in their mind, I want CO2, what's it called?
Ablative.
And you might say, actually, no, I don't recommend this.
Yeah.
And they need that. They need to come in and know that they are safe in the doctor's hands.
Oftentimes, the patients come, they want something. They have a target, they have a goal.
Yeah, they have something in their mind.
I want this.
Yeah.
With this.
Yeah.
You know? And then we say that doesn't match, you know.
Okay, that's good that you can say no. And I think that's when the trust is built, is when someone doesn't just give you what you want because they want the money. But your priority is the patient's care. So you can direct them into getting the results they want with the right machine.
Correct, And then also, we always think also, you know, with budget, because it's very important. You can just spend a lot of budget on one treatment. And then after that, you won't achieve necessarily what you want. So in that case, why is it personalized?
Yes.
So we have to put it everything we have to design it so it's suitable for that patient. It may not suitable for another one. So that's why knowing the expectations and then knowing also how to fit it into their budget.
Okay.
And then we can do this, and this will be your expectation if you do this.
I love that.
Yeah, and
so
then
it's like a plan.
Yeah, a plan. Yeah. Or if you want something more, then you have to combine this, and this, then you will have more results. So just everything is adjusted and can be discussed. Yeah.
I have a question for you. A lot of the people who visit Bali through either Facelifting Bali Facebook group or Star, our Facebook group, they can only maybe come for say 2 weeks, but they want to have like a nice schedule that they can do when they arrive. Is it possible for them to have a video consultation while they're in Australia and then create the plan so that when they arrive they know what's happening on Monday or Thursday or Friday?
It is actually quite possible to do that.
Yeah.
But the thing is that sometimes when you see someone's on video,
it's better to be face to face.
Sometimes you're giving
false impression.
Yeah, like a false impression, and you give like a wrong, maybe not really wrong, but a little not accurate recommendation.
Yes.
Because when you see someone in person, you can kind of like have a feeling and
you need
really
to
see your texture and see how it is.
Okay.
So it would still be better if that patient will come here and then directly, seeing this like this in a real consultation room.
Yeah. Maybe they could have the video call and you could create like a possible proposal plan to say...
Possible, but it may still change.
Exactly, and it's managing their expectations to say, if we decide to do this, this and this is what it will cost, so they can plan their budget. But please know that it may change once we're face to face. They may not need it, or they may need more.
Yes.
You don't know until you physically feel it.
Do you know what interesting is that with the patients, when they come to consult to me the first time, and then they come back again to do the treatment in the next 2 weeks. Because they need to plan, In 2 weeks, it will change.
Yeah.
It can change.
Yeah.
So how about video consultation? So it's not really reliable.
Yeah.
So, but anyway, it's possible. Of course,
it's possible if they wanted to. If somebody wanted to.
Yes.
Do you think your prices would be more effective than Australia?
I think so.
Yeah.
Yeah. So much more effective because we got a review that we have much better prices here in Bali compared to Australia.
Yeah.
Yeah.
Okay.
But maybe recently I hear that in Australia, like Botox is cheap, but probably the injector is not like from doctor. It's like nurse injector, probably.
Yeah, you get that a lot.
Most likely because I ask, and they would say, the injectors are nurses. So if their injector are plastic surgeon, for example, I think the pricing structure will be so much more than here. Even like a GP there or aesthetic GP. I think the pricing structure should be different from here.
Okay, so if we asked at the beginning of the chat what would be the most popular 3 treatments. I think you've just rounded them up, if I remember correctly.
Yes.
I can't remember the name of the machines, but there was 2 different machines and then probably the injectables.
The injectables is actually our still most wanted procedure here other than machine, because we were talking about technology. That's why I bring up the machine first. But actually our most wanted procedure is still injectables.
Botox fillers.
Yeah, but
stimulators.
Botox. Exactly.
You do salmon DNA.
We do everything here.
Is it
Profilo is one of the skin boosters.
Yeah, okay.
Yeah, the injectable derma filler is still the mainstay, because there's nothing yet replacing the derma fillers yet for face contouring. If you want a quick result, less downtime, it's no replacement yet for derma fillers. But I think lately the people start to get scared because they see a lot of things goes wrong.
They go too far with the fillers.
Things goes wrong. I think it's mainly because probably they go to the wrong injectors, or they are doing not in the medical background injectors, because you can just self-inject. You can see in the YouTube people self-inject. Of course, it will go wrong.
That's so alarming.
So and then those kind of things is like really concerning the patient. But I always, manage to tell them that's not the truth. We always try to achieve the very natural result. And then in a very subtle way, natural. We respect people's uniqueness. and then we just enhance their natural beauty.
I think that's a really good point. I've been seeing lots of coverage lately where there's been a huge rise of people getting their fillers dissolved and then starting again because they've gone to so many different doctors and then maybe it's migrated or they've started to look not like themselves anymore and people can experience filler blindness. They're like, oh, my lips aren't big enough, and they're like, no, they're fine. You don't need any more. But the doctor will still continue to do it. So do you get many people getting them dissolved and getting them redone?
Or not from myself. I mean, like not from the procedure that we injected here.
Doctors,
because the one that we injected here is always achieved them in a natural result. They're quite happy because it doesn't visible. The filler does not visible. It just make them look young and more attractive and
that
more
should be
defined,
the key, right?
more contour. But it's some situation where the patient is been like mixed injectors, and then we also don't know what type of fillers, because there's like maybe hundreds brands of fillers now. It's even growing more. I don't know how many brands of fillers with the different quality, with different characteristics placed in the same face.
Oh my God.
So that means that, of course, you cannot be in a good result. And then
that's so interesting. All of these different fillers have different characteristics. I've had Botox and fillers on and off for 20 years. And I don't know. When someone says, what brand did you get? I'm like, I don't know.
Sometimes even the filler itself, because there's filler with HA and then fillers mixed with the calcium hydroxyapatite. And then it's actually permanent, semi-permanent filler, which was used a lot before. And then people just think that, this is not dissolvable. Of course it's not dissolvable because it's a semi-permanent filler.
Wow. So you really need to ask the question. What brand is it? What are the characteristics? And what are the long-term results?
And it's also ranging in price.
Of course.
Some are very cheap because it's just cheap, the product.
So don't necessarily go for the price, guys.
Go for the quality and brand, right? Quality and brand.
So there's a huge menu of different things that Dr. Rosa offers here at Eterna, and one of them stood out to me and that I think will appeal to lots of women, and it's a vaginal tightening, is it a laser?
With laser.
Which, if you're suffering with something like a little bit of incontinence or you've had children, this can really help. So I will let the expert tell us a little bit more about it. What is it called, officially called?
So it's called in the different names actually. So for vaginal tightening, you can call intimalace. And then there's for those women who have been menopause for a long time.
So what you said, like over 50?
Probably around 50, 55, even 60 and more. They have a condition called vaginal atrophy, and then we have to do a procedure called rejuvenation. So we are actually trying to make the mucous membrane all around the vaginal canal
become the mucous healthier. Membrane. So what is that? Is that like a fluid or something?
No. It's just like a mucus. Like for example, in the skin, it's a skin. But in the mouth, it's a mucus. Mucosal wall. Let's say mucosal wall. So it will help to rejuvenate that area with the laser beam.
I see. So it rejuvenates that area by increasing the membrane?
No. It's by the heat, it will rejuvenate, and then it will increase the collagen production, increase the firmness.
The firmness.
The firmness of the vaginal canal.
So you would have like if somebody was suffering with maybe leaking a little bit when they sneezed or laughed too hard.
Exactly.
It would help reduce this.
So for incontinence problem, I think the laser is the perfect treatment. Because then you can really targeting the area where the urethra is, and then make that area healthier with better, like a blood supply, and then
so it's the blood supply as well, right? And then what about like the internal walls of the vagina area? Does that tighten as well? If
it will tighten
to increase the intimacy?
Yes, it is, and then reduce the pain during the sexual intercourse. It will help also the marriage life. So it would be more comfortable for the woman, and then she would experience more pleasure, and the man too. Exactly.
And how many treatments would somebody need to have?
Usually in the first treatment, you would definitely feel the difference already.
Really? It's quite instant?
It's instant, but maybe the next week after.
Yes. Oh, I see. So after it's created, is it like a stimulation?
Yes, stimulation.
Then the body responds accordingly and keep working?
Yes. And then after that, you are supposed to repeat again, of course, in the course like between 4 to 6 weeks later.
Okay, so every 4 to 6 weeks later, keep doing it. And
until you feel like you're satisfied with the result. So most likely people feel very significant after 3 times, sometimes 2.
Wow.
Yeah. So it depends.
And how long does it last?
Depends also the severity of the
Oh, it depends on the severity. Okay.
It's very interesting when somebody is asking how long it lasts, because everybody will
Everyone say different. Yeah.
And then the older you get, probably you need like more sessions. The younger you get, you need 1 session, it lasts for 2 years.
Okay.
So it's like, it's like different. Yeah. Okay. And some people, they just have to keep doing it, especially when they have a condition called uterus prolapse.
Prolapse, okay.
Yeah. So it means that the uterus is descending because of the laxity all around the area. The laser itself, Photona, cannot really make the tighten of the ligament on top there, but it will help some of the symptoms, which is very uncomfortable. You feel like very heavy and it's down there. Okay. And then usually after you do the session, it will start to feel better.
I see. Okay. Yeah. So us ladies have all of these annual procedures that we want to get done, like looking after our skin, our Botox, our fillers, and now really we should have an annual procedure of tightening the vagina area.
Yes.
So pop it on the list, ladies.
That's something for the personalized approach. You see the patient is having that, and then we do that. And then we also do the body treatment here, like for fat freezing. Okay. So fat freezing is also one of the very popular procedure here. Okay. Because it's an instant way to remove your unwanted fat.
Oh yeah?
Yeah.
So fat freezing?
Yeah, we have the fat freezing.
Okay.
And then after that, we also have the axialis body. It's like with heat, so we combine, like the ice freezing with heat treatment to remove the unwanted fat.
Okay, so it could be like the body treatment, freezing the unwanted fat, and then the heat to contour the body, and then the laser for tightening the vagina. Yeah, so they have a whole list of things that we can get done.
Yeah, that's what we expect here. We try to mix and match everything that can actually improve whatever you feel not comfortable with.
Amazing.
Yes.
So we could talk forever about the whole choice, but right now we want to understand, how do we look after our skin?
Okay, that's interesting. So we will talk about the skin health now.
Skin health.
Yeah. So in Eterna, we are taking a comprehensive approach for the skin health. So usually we combine 3 kind of things. The first is the collagen stimulator, and then skin booster. Then after that, it comes with the equipment. So collagen stimulator, we start with collagen stimulator because...
Is that injectable?
It's injectables,
Or a machine?
It's injectables, actually. So collagen stimulator can be with machine. And this time we're talking about injectables.
But this time we're talking about injectables, okay.
So the injectables collagen stimulator will increase the skin firmness, and then it will build your own collagen. It will take time.
We all want more skin firmness.
Yes.
Tell me more.
It takes time. But at the end, you have a firm skin and a healthy skin. And then it's just good. But at the other hand, we also usually combine, again, collagen stimulator with skin booster. It's because we want to deeply hydrate the skin.
Okay.
And then because after we deeply hydrate the skin can achieve what we call as a glass look. Is actually the healthy skin, because with the deep hydration you can increase the collagen production, elastin productivity, and then when you see it's like a glow, a radiance. So that's what the skin booster can help.
Okay.
On top of the collagen stimulator.
Yes. It's like food for the skin.
Yes, food for the skin, especially like food or nutrition to your skin.
Okay.
Yeah. And then if you see, because sometimes with the patient, when you don't have any structural problem with your skin, those 2 is enough. But oftentimes we see like structural issues, like for example wrinkles, some pores, some scars, even like an acne scar.
Okay.
then we have to add up more, we use our equipment.
Okay.
Yeah. For example, the equipment that we can use is either like ablative, non-ablative, or we can use just microneedling with silver X. But
is that the name of the machine?
It's the name of the machine. So basically, it's a gold-plated needle.
Gold-plated needle.
Yeah. Okay. With the radio frequency energy on the tip of it, it goes into your skin without causing any thermal damage on your top of the layer of the skin. So that's why it's a low downtime, very, very short downtime.
Okay.
And then it will address the problem underneath your skin.
Okay.
Depends on the depth of the problem. So we can adjust the length. Even like 0.3 or 0.8 or 1.2.
Okay.
Different from wrinkles. We go a bit deeper.
Yes.
So the good thing about this is that when people don't have too much time because they are on holiday here, they cannot, they need their time.
Yeah,
to
they want to show
fun.
their face. Yeah.
Yeah, so this is the treatment that they can do here. It's also an option. And then we even can combine it with radio frequency non-needle, like we have here Axialis, Ultra 360.
I've heard of Axialis, yeah.
Yeah, and then you can just combine everything. It's a mix and match of the technology to achieve what you want.
Okay. And who would be a typical person for this? Would it be somebody in their 30s as a preventative measure, or would it be somebody in their 50s wanting to try and reverse the signs?
Oh yeah, that's a very good question, you know.
Yeah.
In my opinion, everybody can benefit from it.
Okay.
Yeah. So even when you're very young, if you still have a very good skin, then you can do it as preventative.
Preventative, yeah.
Then your skin can look good. You never look having not good skin because you always do that.
Yeah.
But if you're already like 50 and you never done anything, probably you need to go beyond this machine as well. You know, you have to also combine it with the other things, like what I said,
like the stimulators as well.
Stimulators, and then we put the booster as well. And then we incorporate also the machine, which is, and probably also need something like more stronger than just Silphium X. We can combine it with our erbium or our CO2.
And would it just be the face, or is this okay for the neck and chest?
It's actually okay for face, neck, chest, hand, anywhere.
Oh, okay.
Anywhere you want.
Yeah. That's a really good point, actually, because I think most of us focus on the face and the neck and we forget about the hands, and the hands are a real telltale sign of age.
Neck, hand and neck, actually.
Yeah.
People forget about the neck.
What can you have done to your hands?
On the hand, you can do the treatment, because here you can just do a laser if you just want a quick, you know, you don't want too many, you know, injections, But then if you do a collagen stimulator on your hands, it will make your hand look healthier. Yeah.
Especially with the sun as well. I mean, I'm British and I'm typically very, very white, and I always have to cover my hands.
Correct. Yeah.
But sometimes I forget, and then my hands go all wrinkly, and I have to put my gloves on. And especially for Australians as well, because the sun is so strong in Australia. Yeah, so they really need to look at maybe these treatments, especially if they don't want to go under the knife.
If
they don't want surgery, this could be like a really good plan to maybe do like every 6 months maybe.
I think it should be done in the beginning a bit shorter.
Yeah.
And then after that you can do maintenance every 6 months.
Okay. So a lot in the beginning, and then once the effects have started to happen, then you can
maintain a bit longer gaps.
Yeah. Amazing.
Especially when on hand, surgery is not an option. You cannot do a surgery on your skin on your hand.
No. For anyone watching that is interested, the best thing to do is send an email or a WhatsApp, is it?
Yes.
Yeah. Make sure you mention FLIB, and then they can coordinate the consultation and then make a recommendation of what is needed.
Yes.
Great, thank you.
Yes.
Thank you. Patient Concierge Services. We also represent STAR Facebook group, Surgical Transformation and Aesthetic Rejuvenation, as well as FLIB for Facelift in Bali, where we help people know what their choices are for cosmetic surgery and what treatments are out there that can support them through whatever it is that they feel is of concern. And today we are in Eterna with Dr. Rosa.
Hi.
And Dr. Rosa is going to be doing treatment that resolves any issues around snoring. So do you want to tell us a little bit more about what it is?
We call this treatment night lace. So it's a treatment for snoring. Usually when people snoring, it's because of the laxity inside their airway.
Okay.
And then also the narrowing of the airway.
The narrowing of the airway.
Narrowing of the airway. So
it's really common, yeah?
Yeah, it's very, very common.
Very common.
Yeah. Even though not all snoring can be treated with this procedure, but there is some type of snoring which can be effectively treated with this procedure, and it will help the breathing. Yeah.
So it increases the elasticity inside the mouth, the laxity, did you say?
Yeah, it's actually increase the firmness around the airway, so it will less obstructing.
So when someone snores and it makes that kind of rattling sound, is that the skin because it's kind of loose?
Yeah, correct. Because
so you're tightening the skin, which means less snoring.
Yes.
Which means more happier relationships.
Yes.
Less fighting.
Yes.
I remember my ex-boyfriend used to wake me up snoring, and I'd be like, turn over, roll onto your side. So this will hopefully reduce that.
Yes.
Okay.
So it's using heat from the laser beam.
From the laser beam.
Yeah, but we call it like a smooth laser beam. It's not like just laser.
Is it a comfortable process?
It should be a comfortable process. Yeah.
Yeah. How many times do you need to have it done?
So usually you are going to have like serial treatments, like 4 times or so. Yeah.
Okay.
And then after that, it should be improved in some degree. Sometimes when the case is like quite heavy, you probably still need to use a CPAP machine to reduce it like really in a more significant way.
Okay. Yeah. So once you've had like 4 or 5 sessions, it should last how long?
It should last quite a while. It depends.
Like
it's very individual. It's very individual.
Yeah. Yeah. Okay.
Yeah.
Great. Well, we'd love to see you in action.
We finish. So, okay. So after this, again, like if you feel uncomfortable in the throat or itchy or dry, just keep drinking a lot of water, and then like vitamin C, it's also help, like for the cell regenerations after, right? And it will also improve all the healing. So, yeah, I think that's it. Do you have any questions?
Did it look like it was open more from last time?
I think so. Yeah, I think so. So, I just want to know what was the result from the first session. What do you feel after the first session? Because your airway is quite narrow, actually.
Just a bit more better breathing.
Better breathing. That's it's actually breathing is very important, especially during night, during sleep, because it's a recovery time for you. Getting enough oxygen is very important.